Experts speak the negative effects of parental depression, a presentation by experts. Depression is a serious mental illness and can have negative impact on families if left untreated. Often studies have concentrated on how maternal depression negatively affects the children's behavior. While these studies should not be discounted, it is important to examine how depression in both parents can have an impact on child's emotional, social, and behavioral development. When both parents are depressed, the chance of children in that type of environment developing disruptive emotional, behavioral, and social problem increases. The article Remission of Depression in Parents: Links to Healthy Functioning in Their Children examines the correlation between healthy parents and healthy children and unhealthy parents and unhealthy children. This is why treating parental depression is important. Recent studies have also mentioned that depressed parents lack good interpersonal relationship skills, which could cause a tense relationship to form between the child and the parent, and this tense relationship could later develop between teachers and children. Our two experts today are Dr. Kelton Starr and Forlia Day. Dr. Kelton Starr received her doctorate in 2006 and has been working in her field for 8 years. She is affiliated with the American Counseling Association, while Forlia Day is a clinical social worker with a master's degree. She has been working in her field for 10 years and is affiliated with the National Association of Social Workers. Dr. Kelton Starr believes in working with cognitive behavioral therapy and pharmacotherapy when necessary. Studies have shown that early detection of behavioral problems and treatment with cognitive behavioral therapy has improved the chances of children having a higher quality of life. In children with depressed parents or one parent, treating disruptive emotional and social problems early may be the key to prevention. Of course, when treating depression with cognitive behavioral therapy does not work, medication may be necessary, and she's a firm believer in working with psychiatrists and health professionals to create the best treatment plan for her patients. 3 websites that she promotes are Children's Hospital.org, acap.org, and the University of Michigan.edu, which all have wonderful educational articles on there about disruptive behavior and when to seek professional help. Forlia Day is a clinical social worker who believes that a child's behavior can be a reflection of their parents. She believes that providing parenting skills are especially important in families where parents are depressed and may be struggling with the ability to form close interpersonal relationships. By providing families with the tools for success, this could prevent emotional or social problems in children. Her main concern is that children in homes with parental depression may not be receiving the correct attention or care from the parents, because when parents are struggling with depression, they may unintentionally neglect or maltreat their children. She believes in working with healthcare professionals to develop the best treatment methods, and 3 websites that she promotes are pacer.org, healthychildren.org, and kidsmatter.edu. All 3 of these websites have excellent articles on them that promote psychologists and social workers and help parents decide whether their child is having a behavioral problem or not. Research methodologies between social workers and child psychologists are similar and slightly different. Some of the methods used by social workers to treat patients are psychotherapy, counseling, education, and case management. Likewise, a counselor can also use counseling, psychotherapy, and education. A child psychologist or counselor may also use or do research in clinical trials, single case studies, and other methods. One of the best things about clinical or single case studies is that it is easily repeated and the treatment is over a long period of time. So Dr. Kelton Starr believes in early treatment for the family, cognitive behavioral therapy modalities. Forlia Day believes in parenting skills, providing educational material. Basically, they both believe in working with healthcare professionals. And these are the references for all the material found in the page today.